Hi and welcome to my podcast, the Fertility, Motherhood and Wellness Show, True Stories with Dr. Rajeev. Through this podcast, I will be dealing with issues related to fertility, safe motherhood practices, as well as women's health. I have been delivering babies for more than maybe 25 years now. That's a long time, during which most of the information that I pass on to patients is almost standardized, almost like a tape recorder being played. When that happens, you also take certain things for granted, which is why I was very surprised when Ritika Singh Goyal, a friend, sent in a request with a whole lot of questions, saying that these are the most common questions she had in her mind post-delivery, and the same was echoed by her friends too. Because I do this every day, it never struck me that this could merit an entire podcast episode. So thank you, Ritika, for making me do this. So here I am once again with Dr. Apurva Pallam Reddy, my friend and an eminent gynecologist, IVF specialist, laparoscopic surgeon from Bangalore. I have done so many podcasts with her, and of course, we together have this series of Instagram live sessions called What Women Want. And we are also currently working on a 3-series podcast on endometriosis, part 1 of which I have already uploaded. Thank you, Apurva, for being on the show and giving your valuable inputs for this podcast.
Thank you so much, Dr. Rajeev, for having me. Although I can't boast about a 25 years of experience, but I think I have a little experience on C-section because I have had one. So I'm hoping to be a little more beneficial in this, both from a doctor's perspective and from a client's perspective.
Absolutely. I'm sure you'll bring a lot to the table. So Apurva, let's start. It's a whole rapid fire of questions. There are plenty of questions, so we'll have to do this together. Otherwise, I think the podcast will become endless. So how soon after C-section can one get back to brisk walking? And does this change if this is a second time?
So there is no harm in walking even 15 days after undergoing a cesarean section, as long as there is no pain in the stitches and the body is not giving any untoward signals. The same holds true even after a second delivery. So technically you can walk right away after your section, but brisk walking or any sort of activity, you can start within 15 days.
We really make the patient walk, within 24 hours itself from the surgeries. She's walking around in the hospital, absolutely normal.
Absolutely. So how soon do you think after a section can one start practicing yoga and does anything change if it is a second time?
So basic yoga as an exercise can be started as soon as 6 weeks after a cesarean section, because by that time the internal stitches have really healed. The same holds true even after the second cesarean. The only ones who need to be a little careful with exercise are those with uncontrolled diabetes and very high body mass index, that is excess body weight. These women may have a higher chance of internal stitches not healing well or healing late. And thus, I think our medical advice would be to start with diet control and brisk walking, and once the weight goes down a little, then to start with the basic yoga stretches. This would reduce the chances of developing hernia quite significantly. So after a C-section, when is it okay to start weight training?
So a lot of people have these concerns with respect to activity, walking, and how much amount of training we can do. Weight training specifically should be postponed till up to 3 months after delivery. Those with a higher BMI and uncontrolled diabetes should first start walking, diet control, and from then they should be going on to doing a higher level of activities like weight training. So if breastfeeding, should one avoid extensive workout? Does it hamper the lactation?
Once the breastfeeding is established, that is, the milk has started coming, it usually does not go down very easily. Mild to moderate intensity workouts have absolutely no deleterious effect. It, however, would be wise to postpone very high intensity workouts or heavy weight training workouts till 4 to 5 months after delivery, because this period of 4 months is the most crucial period for breastfeeding.
Totally.
So what should be avoided? Is there something which should be avoided to be consumed for the first 2 months post a C-section?
I think this is again the most common asked question. They have so many concerns regarding the food. But I think we need to break it to everyone that there is no food really that is a taboo in the days of week following delivery. High protein diet would probably be good along with some specific nutrition for increasing the breast milk. But apart from that, very sugary food is probably not good for the healing of the stitches, especially in women who are obese and diabetic. Apart from this, I think there is really no restriction that needs to be levied on women, irrespective of the kind of delivery that they have.
So a patient, once I had delivered someone, and when I went in, I think on the second or third day after surgery, she said, Doc, can I just order some food from outside? And I said, you can order a pizza or a pasta or anything else from Swiggy. And I think the mother was sitting there and she almost had a heart attack when I said that. But that's really true. They can really have any sort of a food as long as it is nutritious and healthy.
So is there a way to get rid of the small pooch that develops due to a C-section?
So a small bulge may remain for some time for all women post-delivery, irrespective of whether they deliver vaginally or by a cesarean section. This will reduce depending on the subsequent weight loss and also the inherent elasticity of that particular woman's skin. After a cesarean section, however, the skin at the site of the incision may get stuck to the underlying tissues, thus making the bulge above it a little more prominent. This is more common after the second delivery than the first, as the scar formation is more. So when the woman is undergoing a cesarean section, I normally try and, for the second time especially, I normally try and free the skin from the underlying tissues so that the skin can be joined together afresh with probably, a reduced chances of a scar formation. And I'm sure you do the same.
Right. I mean, a lot of times I've even heard, the mothers of the patients asking me, आपने एक बच्चा छोड़ तो नहीं दिया अंदर, अभी भी इतना बड़ा है, it's still so big. So yeah.
True. So how long is it normal not to get a sensation above the C-section cut?
So when we make a transverse incision for the cesarean section, some nerves that are running vertically may get disrupted or disconnected. And this may lead to an abnormal sensation of pain or no sensation at all in that region, just above the stitches. While for most people the sensation returns quickly, for others it might take even up to 2 to 3 months for the sensation to return. Now during this time, one needs to be very careful when doing any kind of warm compresses on the stitches, because since you're not very good at sensation in that region, you have a higher chances of burning yourself. I also advise patients to put a towel on the stitches and then apply the warm compresses, thus negating the chances of having any kind of burns.
True, absolutely. I do the same.
So is climbing stairs like one floor inside the house or, in a duplex kind of scenario, 10 days after a C-section not advisable?
I don't think there's any restriction on climbing stairs after a cesarean section. I mean, we tell them all the time, but I don't know, even after telling people, that somehow this thing remains stuck in their heads. The sutures that we use for the stitches today are so robust and strong that a little bit of staircase climbing every day is not going to cause any problem on the stitches. So please go ahead. You're living in a duplex house or you need to climb stairs for any particular reason, even a couple of days after a cesarean, forget about 10 days, it's absolutely fine.
Right. So we generally recommend that, they need to kind of take some amount of support while climbing the stairs. But that is only because, they have higher chances of having giddiness or dizziness, especially when they are taking the stairs. So beyond that, it really does not have too much of an impact over the stitches in itself.
Next question. So does sleep deprivation affect lactation in breastfeeding mothers?
Of course. I mean, any kind of stress can reduce lactation. And the stress of not having lactation also can reduce lactation. The stress of fight at a home, unfriendly feeding environment at home, and it could be extreme sleep deprivation as well. Having said that, every mother who is breastfeeding manages to only catch about 40 winks in between the feeds. As long as it's not seriously affecting her mental and physical health, the lactation probably goes on unaffected.
Absolutely. A shout out to all the women out there, and especially the mothers. They're built so strong that they can probably handle most challenges very easily, where men would miserably fail.
Right. So till when after the C-section can you not lift heavy things at home?
If by lifting heavy things one means lifting the previously delivered child, I would probably say for about 3 months you should not be doing that. That would also
Right.
mean not lifting heavy buckets or heavy objects around the house. Now, obviously, if one has a small child, the child is going to require or want to come to the lap or would require being lifted up. So, for that, I always recommend that women sit down and have someone place the child in a lap for the first 3 months rather than picking up the child from the bed or from the ground.
Right. I think the whole idea for this is that whenever we lift anything heavy, a whole lot of pressure happens over our abdominal muscles. And because the uterus and the entire pelvic structures are lax and they are healing, there is a good probability that, in the future you have uterine descent or prolapse happening if you do lift heavy weights before you go ahead and have complete healing of the pelvic structures.
True.
So if one is suffering from postpartum blues or they're feeling a little low or sometimes even they think that they're actually going through postpartum depression, how do they go about it? Whom should they be consulting for this?
So, postpartum depression can be a very serious problem and with very serious consequences. We normally try and identify women who are going to be at higher risk of developing postpartum depression right early in the pregnancy itself. There are signs and signals which you and I as a doctor we pick up, and we normally refer such women for counseling with a psychologist very early in pregnancy. Of course, I must admit that of all the people that we do refer, most are averse to counseling because it somehow seems to have a very negative connotation. It's as if we are labeling them as mental or depressed, which is honestly absolutely incorrect. Mental
Right.
health needs attention and care just like any other part of our body. Again, during the pregnancy, we keep looking after these women and watching out for them. Even after delivery, during my hospital rounds, I'm usually a little alert to picking up the signs again. Some women can be extremely emotional at this stage. Again, despite best efforts, we do not manage to read the signs, and I get calls from the woman herself or her family members
True.
telling me that she's extremely depressed. It's very important to immediately take the help of a psychologist or any other trained professional for dealing with such an issue. The family must understand that this is a medical problem with extremely serious consequences if not addressed early enough and should not
True.
be ignored. I have an entire podcast dedicated to postpartum depression with Mrs. Ritika Singh, and she's absolutely brilliantly fantastic at her job. I would strongly recommend anyone having such issues to get in touch with her. And I'm sure you have your team as well of counselors who would be dealing with such things if at all the problem arises.
Right. I mean, I think I personally had, probably if I might not be able to categorize it as a postpartum depression, but I definitely had postpartum blues. And it almost felt at that point like, it's going to be the end of it. And my whole personality of actually being a happy or a chirpy person has now completely changed into someone who could probably cry at the drop of a hat and, who was really emotional about everything that is happening around her. But yes, I think with the right amount of help, things changed and, we improved. So as doctors, as medical professionals, in case if we ourselves can experience these kind of situations, then I'm sure everybody can. It is just that we need to be able to pick it up at the right time and deal with it appropriately.
Let me ask you this since we are on this topic. Do you think professionals have a bigger problem with postpartum blues and depression? Because as we speak, just a couple of days back, I got a call from someone I had delivered. She's a professional herself. And she was like, Doc, I'm at such a crisis in my life. Now, I don't know. I'm having an identity crisis. I don't know if this was the right thing to get into. I don't know where my life is going to go. So, as a professional, do you feel that sense of sudden loss, or you don't know how you're going to get back to that professional life?
Definitely. I think that's the concern for us. As working professionals, we not only have to maintain, a decent personal environment. Be a great mother, be there for the kid, and you also have somewhere at the back of your mind as to how your professional life is going to change from this point. And when you will be able to get back to that working environment and take things forward. So it naturally, I think, adds up to the pressure. And obviously, when you have too many inputs that is coming from your friends and family, and everybody has different expectations out of you. So yes, I would say there is a higher probability that working professionals have a slightly higher chance of experiencing more turmoil. Having said that, it doesn't take away the emotional turmoil from anyone. But yes, I think that's my personal opinion.
So, after a cesarean section, when is it normal to get your periods back? Also, is it normal if they continue to be painful like before they had the baby?
Whether it is after a C-section or a normal delivery, periods usually come back after 6 weeks, or they can get delayed up to a year also. And this depends a lot on, the breastfeeding pattern of the mother. Women who are exclusively breastfeeding get periods later than women who are doing either a mixed feeding or who are exclusively bottle feeding their child. The logic behind this is that when one breastfeeds, a hormone called prolactin is secreted, and this delays the periods. So if you haven't gotten your periods for a long time after your delivery, but you are sure that you're not pregnant, then you don't have to be worried about it. Usually the periods are much less painful after delivery, but in case they are now more painful and your doctor did not see anything untoward inside the tummy or inside the uterus at the time of surgery, you don't have to be worried about that. No harm in getting a vaginal ultrasound done though, in order to make sure that we are not missing out on any unforeseen problems. So what kind of contraceptive is advised post-delivery which doesn't affect the lactation or the normal cycles?
As you mentioned, women may not get their periods for an extensive period of time after delivery. However, during this time, ovulation may still occur and she may still get pregnant. Thus, it is very important that after 6 weeks of delivery, some form of contraception be used, irrespective of whether she is getting her periods or not, as long as she is sexually active. Contraceptive choice will depend on a lot of factors including age, other medical problems, other hormonal issues like PCOS, condition of the uterus, and of course the sexual frequency and when the couple wishes to have another child, if at all. Breastfeeding, once established, does not reduce with the use of oral contraceptives, and they can be started at 6 weeks after delivery. However, my first choice of contraception at that time will always be the insertion of a Copperty or intrauterine device. It takes just about 30 seconds, is hassle-free, and thereafter one need not even remember that one has a Copperty inside. It is almost 99.9% effective and can be used for 5 to 10 years without requiring a change. If at any point before this the woman wants to get pregnant again, the Copperty can be removed in flat 2 seconds and fertility returns in 24 hours time. Contrary to popular belief, the Copperty does not have any side effects in 95% of women, and in the other 5%
True.
as well, problems usually settle down within the first 3 months of Copperty insertion. The other contraceptive choices can be, of course, condoms, especially those who don't like using pills or won't get a Copperty inserted or do not have a very high sexual frequency. I think we must add here that relying on natural methods like withdrawal method or safe period method are not advisable, as they will be having a very high chance of pregnancy.
Absolutely. I think this contraception is extremely important, especially after a cesarean section, because there will be a safe time which we will kind of get back to. So it is imperative that we use some form of effective contraception. And for everyone who has concerns about how good or how effective a Copperty is, I kind of tell them that I've been on it for 5 years and it is absolutely fantastic.
How long after C-section is it all right to consummate?
Honestly, even after a vaginal delivery or a cesarean, women will have some amount of discharge or bleeding or probably spotting for about 2 to 3 weeks, and some might have it even for a little longer. We normally advise to resume sexual activity after 6 weeks in either case. It is all right to be physically sexually active even before that also, but it just depends on their comfort level. Especially in case if they've had a cesarean, it's not going to increase their chances of infection per se. but we definitely ask them to avoid for the first 2 weeks. Considering the horrible waking and sleeping hours and constant breastfeeding and everything else that comes with having a newborn child, I don't think it resumes for months for most couples.
True.
So does eating variety of cuisine or spicy flavors affect the digestion capability of a newborn from the breast milk?
It's an absolute myth that change of cuisine or increasing spices will affect the flavor of the milk that is produced by the mother. I think this myth needs to be rested once and for all.
Absolutely. I think for all the unrated women over there, you can go all over and you can definitely have the kind of spicy food that you intend to eat.
Right. Although the next question really is a continuation of the first one and need not be answered, but I thought we'll still just go ahead and answer. So in case
Sure.
the spicy food does affect the breast milk, till when should a mother avoid spicy food?
Right. So, as we've said before, mother need to avoid food which is having only too much of spices or too oily, not because it will affect the breast milk, but because it will affect the mother's digestion herself. Because there will be a slow recovery for the digestion process. And of course, too much of oily food will make her increase weight, and this will prevent her from losing the weight that she has put on during pregnancy. And high spicy meals or oily food can increase the rate of heartburn and acidity. So these should be the reasons why you should try and reduce the amount of spicy food, but not because it's going to affect the taste of the breast milk. And if you are comfortable eating that kind of spice or that level of spice, then I don't think it should stop you from choosing the cuisine of your choice. So is a C-section belt of any help post C-section, and when should one start using it and for how long in a day?
Depends on why you want to wear a tummy belt. If you wish to wear a tummy belt because you think that the tummy is going to go in because of the tummy belt, then I feel it's absolutely useless. There is no medical evidence to say that the tummy goes in when the abdominal belt is worn for extended periods of time. In my opinion, all it gives you is indigestion and difficulty in breathing. I do, however, advise wearing the tummy belt for two kinds of people. One, whose baby is still in the hospital and needs to travel to the hospital for feeds, maybe multiple times a day. And because you're traveling in a car and there is jerking, it might cause a lot of pain and discomfort, and this tummy belt tends to hold back the stomach and reduce the pain. Secondly, women who are having overhanging bellies may get a lot of pain sensation because of that protruding belly pulling down and stretching the stitches. The abdominal belt in this case will hold back the tummy and thus reduce the pain. But again, if you really want to wear it, or if your family is wanting for some reason that no, you should be wearing the tummy belt, there is no major harm. It's not going to harm the stitches. Then you can wear it. If you do wear it, make sure you take off the tummy belt when you're going off to sleep at night. Do not go to sleep with the tummy belt. You can wear it otherwise all throughout the day.
Right. Honestly, my take on the tummy belt comes from the fact that there is a lot of lax skin around that region post-delivery. So you have a higher chances of subcuticular fat deposition in that area because the skin is lax. So when you use a tight abdominal belt, the probability of fat deposition in that area is going to be slightly lesser as compared to everywhere else in the body. So that's my whole honest logic understanding of how a tummy belt is going to be beneficial.
Okay, so we differ on that one a little bit. Doesn't matter.
Sure.
So does breastfeeding eventually lead to breast sagging a bit, and is there a way to avoid it?
This is absolutely crazy. So during breastfeeding, or for that matter during pregnancy itself, the breast size definitely tends to increase, and it gives an apparent appearance of sagging breast because of the increase in size. As far as prevention is concerned, I think it starts even before pregnancy happens. The muscles on which the breast rests, that is the pectoral muscles, needs to be strengthened through various exercises before pregnancy or during pregnancy as well. During pregnancy, using good supportive bras which can be worn, and this should be continued even after delivery. One needs to get back to specific exercises 3 months post delivery in order to prevent the appearance of a sagging or a lax breast. Most lactation experts feel that change in breasts tends to come back to normal in size and shape after a couple of years of stopping breastfeeding. So, is it okay to consume a glass or two of wine post baby birth, and how old should the baby be in case, in terms of a breastfeeding mom?
Anything that the mother consumes may be extruded into the breast milk and does pass on to the baby. So the standard answer would be no alcohol should be consumed as long as the woman is breastfeeding. Having said that, a glass or two of wine may not cause so much of a problem as long as it is taken very, very occasionally. If one is planning to take alcohol any particular evening, it would be advisable to express the breast milk and feed the baby the expressed milk instead of breast milk after having consumed alcohol. It would also make sense to drink plenty of water before and after having alcohol so that the body flushes out all the alcohol before the next breastfeed. I would say as long as one has maybe an 8 to 10 hour gap between the alcohol
Sure.
intake and the breastfeeding, it would be safe to go ahead and breastfeed once again.
Absolutely.
So, how long does it take for the uterus to shrink back to its normal size post delivery? And what should be the ideal time frame for new mothers to expect to get back to healthy weight scales post delivery?
So the huge size uterus holding the baby shrinks back and hides behind the pelvic bone even before the mother leaves the hospital after delivery. However, it takes about 6 weeks for the uterus to completely shrink back to its pre-pregnancy size. So as far as weight loss is concerned, not a gram is going to be lost unless the woman works out towards, doing a regular exercise and making sure you're having a planned diet. Of course, the weight of the baby, the placental tissue, the blood parameters that are changed will result in about 5 to 6 kg lost right away after the delivery. Again, that can be camouflaged by some amount of edema or swelling that still retains. So yeah, the diet, continued breastfeeding, and a proper healthy exercise is what is going to help you get back to your pre-pregnancy weight.
I think whatever this 4 or 5 kilos that you said may be lost is all gained back during the Japa period, being fed
Right.
excessively at that
Yes.
period of time. So it all balances out.
True. So how do you think we should handle engorged breasts in the first few postpartum weeks?
Engorged breasts happen when more milk is being produced than being expressed or fed. This can be a difficult and scary situation because the collected milk may get infected and cause an abscess formation, resulting in high fever for the mother along with severe pain in the affected breast, which is red and warm. This then requires antibiotics, and if that doesn't help, then it may require a very small surgery. It is best not to allow the situation to develop in the first place. The moment you feel the breasts are getting a little hard or lumpy, get in touch with your lactation expert and see how you can express manually or through a pump. Express the milk to ensure you empty breasts completely. The baby may not be latching on well, or there may be something you're doing wrong which is causing this problem, and your lactation
True.
expert would be the best person to help you with this. In the initial stages of engorgement, when there is a small collection in the breast or there's a small abscess, we normally give a small
Right.
dose of antibiotics, some painkillers, some anti-inflammatory medications, some warm compress, and ask women to try and express as much as possible. Freshly cut potato slices applied to the breast can also reduce engorgement.
Okay, that's a tip that I did not know, and I think I should be sharing that with my clients as well. Great one. So, when does vaginal soreness go away? Lots of pressure down there.
Unfortunately, the vaginal soreness may also happen because of a constant discharge and bleeding and the wearing of a sanitary pad 24/7, which will only go away once these events stop. Do, however, watch out for any urinary infection that might be developing because the symptoms for the same would also feature the same way. If the symptoms are severe, it would make sense to get a urine for routine and culture done and report to your doctor. Now, this is a question which I think everyone wants to know. How do I know when my core is back together?
Right. So I normally advise women to exercise their core about 3 months after a cesarean section and about 6 weeks after a normal delivery. Because of pregnancy and because of the stretching of the abdomen, the rectus muscles, which runs vertically from the midriff to the pubic bones, may separate, causing to what is known as divarication of the recti or diastasis recti. So how do you find out? You lie down on your back with your legs folded at your knee, raise your head with your right or left hand, and try to push the tip of your first 4 fingers to the center just above the umbilicus. You would probably be able to perceive a gap between the muscles. The larger the gap, more is the divarication of the rectus muscles. I think yoga, core strengthening exercises, and Pilates, but of course with the help from a good instructor, would be the right way to go about rectifying this problem. So again, this is something a lot of women keep telling me that, they ask me to sleep when the baby is sleeping and it is absolutely impossible. So what tips do you have for these women, Dr. Rajeev?
I really don't know how to answer this one because biologically I feel I'm inferior. And if I had the capabilities, God would have made me a mother. I really don't know how women go through this. I can only say mothers have a way of finding their comfort zone and catching a quick nap somewhere in the middle of all the chaos. I think you could probably answer this, or I would suggest asking this question in the Mothers Forum to get a better answer.
Right. I'm not sure that I want to really remember that time of my life when I was juggling between my twin boys, turning from right to left. It's crazy because even if they move, you're scared, and even if they don't move for too long and if they don't cry for too long also, you're scared, and you will kind of probably just nudge them a little bit and just see in case they're crying and doing what they need to do.
Okay, so what are some of the exercises one can do to help with the lower back pain?
So contrary to the popular belief, low backache does not happen because of the injection given to the spinal cord for cesarean section during the anesthesia. For a normal delivery as well, women may be given an epidural injection which is far thicker than the needle used in spinal. So the needle for the epidural is used to insert a catheter into the spinal cord, which stays there for up to 9 to 12 hours. If the injection was the reason, then these women would have 10 times the backache that women would have after a cesarean. The real reason for the backache is that all the muscles around the pelvis as well as the lower back relax at the time of delivery because of the pelvis needing to expand in anticipation of a normal delivery. This relaxed state will continue for a few weeks after delivery, be it normal or cesarean section. At this state, a wrong posture, either because of lying down at an incline or while stooping over the baby for hours together for breastfeeding, may lead to severe backache. So the first thing one needs to do is maintain a good posture, and a very good posture from the day of the delivery till the time they continue to feed. Keep the bed back support absolutely straight and sit straight on the hospital bed. When feeding, ensure that you have pillows at the back which ensure a straight back, as well as pillows on your lap on which you place the baby so that the baby is high enough and you do not have to stoop while breastfeeding. 6 weeks after your delivery, you can actually start back doing back strengthening exercises, and that will ensure that the muscles tighten again, and the chances of you having backache thereafter will also be negligible. And when do you think we can actually start driving after a C-section?
This one is really simple. Given a choice, you can drive back home yourself from the hospital after a cesarean section.
Wouldn't that be something?
How do I best take care of my incision after a cesarean section?
I normally advise the mothers to take a shower every single day, starting 2 days after the cesarean section. We use a waterproof dressing at the time so that the stitches don't get wet. If nothing else, the bathing gives you a feel of freshness and helps you recover fast. Once you're home, continue having the shower every day. 2 days later, we advise you to remove the dressing and continue to have a shower even after that. You do not need to cover the area with anything. You can shower normally with soap and water, including cleaning the area or the stitch area with soap and water. Keeping the stitch area clean is the most important thing to prevent infections. Stitches will heal faster if you leave them open and keep them dry. I normally advise women to clean the area with alcohol swab twice a day and apply an antibiotic ointment up to 2 to 7 days post delivery after they have opened the waterproof dressing. 15 days after surgery, start applying Contratubex gel by means of rubbing it onto the stitch for 10 minutes every day and continue for about 2 to 3 months. This gel actually helps in keeping the scar thin, looking nice and preventing itchy and hypertrophy. So what can I do to help with respect to constipation?
Constipation can happen in the hospital because you've not had any solid food for some time after surgery. It can happen because of the antibiotics and other drugs. That is why we normally recommend a small dose of laxative in the hospital, which we continue until about 5 to 7 days post-delivery. This laxative can be continued even after that if required because it passes out unchanged from the body and does not sequestrate into the breast milk. Regarding constipation, 6 weeks post-delivery, I think it is best to ask the nutritionist, and with all due respects, mothers and mother-in-laws are extremely knowledgeable in this regard and provide with a lot of home remedy solutions which work excellent for constipation.
Absolutely. So I keep telling this in case if there are any home remedies which you can use which will prevent your routine ailments, then nothing like it. Only if it doesn't settle with home remedies is when we need to resort to medications.
True. Do these mothers after delivery need any vaccines?
Right, there are only 2 vaccines which women require post-delivery. If a woman is Rh negative in their blood group and the child is born Rh positive, then the woman requires an anti-D injection to be given within 72 hours up of birth to prevent complications in the next pregnancy. The other very important vaccine is the HPV vaccine or the cervical cancer vaccine, which we normally talk about when the woman comes in for a 6 weeks post-pregnancy checkup. If she has not taken the vaccine before, this is a very good time to start taking the vaccine. It just comes as a 3-dose format at 0, 2 and 6 months, and this does not cause any complications for the mother or the baby and does not affect breast milk. Now, if we are actually planning for a second child, when is the best time to start planning for one?
It is advisable to wait about 1 year to 18 months from the previous childbirth before one gets pregnant again. This allows for the body to heal and the woman to gain strength before she can get pregnant again. Scientific studies have also shown that the chances of the child being autistic is 4 times higher if the woman conceives within 18 months of her previous childbirth.
And that's the reason why I think, as we've mentioned before, strict contraception is an absolute necessity. Having said that, in case if you do get pregnant by chance, it necessarily doesn't mean that you have to go ahead and get a termination done. You need to discuss the pros and cons with your doctor and then take a very individualized decision forward.
Absolutely. So many women, even after years of their incision, complain of about a small pain in the incision site when they lift weights. How to avoid being in such a situation?
Unfortunately, there is nothing that can completely take away the pain in such women because the pain probably results from the overlying skin being tethered to the underlying tissue. Only if we were to operate again and release the overlying skin from the underlying tissues would this pain probably go away. However, it would also be important to get an ultrasound done to check for any hernias that is developing or has developed, because the symptoms of hernia also would present in a similar fashion. So how can we prevent pelvic organ prolapse?
So pelvic organ prolapse or the uterus coming down is more common after a vaginal delivery, rather several vaginal deliveries, and especially after an instrumental vaginal delivery, that's a forceps or ventouse maybe, as compared to a cesarean section. The best way to avoid pelvic organ prolapse is to start pelvic floor exercises even before wanting or trying to conceive. Pelvic exercises to strengthen the core as well as Kegels exercises should be started 6 weeks after a vaginal delivery in consultation with your doctor. So, when should a woman contact her doctor if the flow is heavy or doesn't stop?
Now, some amount of spotting, bleeding or discharge of various consistency and color can happen for the first 3 weeks after delivery. As compared to a normal delivery, the bleeding is lesser in the weeks following a cesarean section. For some women, this may persist even beyond 3 weeks, sometimes even up to 45 days. It's always best to let your doctor know that you're bleeding beyond 3 to 4 weeks, and your doctor will be the best person to understand in case if there is any predisposing conditions that might result in your prolonged bleeding, and would probably investigate it appropriately. Sometimes bits of placental tissue may have remained back inside the uterus, and that is what is causing the prolonged bleeding. So your doctor will probably ask for a hemoglobin test as well as an ultrasound in order to try and figure out what is the exact reason for this and decide the management accordingly. So what activities are safe to do in the first few weeks, and which are the ones that we should definitely avoid?
Walking, sitting, climbing stairs, brisk walking, swimming and driving are absolutely safe in the postpartum period. Any exercise or activity that would stretch the abdominal stitches in case of a cesarean section are probably to be avoided. So maybe jumping around or doing stomach crunches or any other form of exercise or lifting weights or lifting a heavy baby, as we've mentioned before, would probably not be advisable.
Sure.
So we've come to almost the end of the podcast now. Last two questions, quickly rapid fire. So can I sit cross-legged on the floor?
Yes, you definitely can sit cross-legged, but I would advise not to do that on the floor, as you might pressurize your stitches while you're getting up from that low a position, especially during the first 6 weeks. However, you can easily sit cross-legged on a bed.
Perfect. That's another myth busted. And what should I do to help prevent deep vein thrombosis?
Luckily, as Asians, we are not at a very high risk for developing DVT or deep vein thrombosis as compared to the Caucasians. Not putting on too much weight would be one of the best things to do in order to reduce the risk of DVT during the course of pregnancy. To those who don't know what DVT or deep vein thrombosis is, it's actually the formation of clots in the veins of the lower limbs because of reduced movements. And these clots sometimes break off from their origin and travel through the bloodstream and may get lodged either inside the heart or brain or sometimes even the lung and cause very, very serious complications. This is why when we operate on women who get pregnant at an older age or on women whose weight is on the much higher side, we normally give blood thinners for a couple of days. Because she is lying down and not moving her limbs, the chances of clot formation are going to be higher. So if you have been operated upon recently, then make sure you keep folding your legs intermittently, or you keep moving your toes in the first 24 hours of the surgery in order to ensure that continuous circulation is maintained and the risk of blood clotting is less. When your doctor tells you to start moving around and walking, make sure you start doing the same. And of course, drink plenty of water, because hydration makes the blood more thinner and reduces the risk of clots. We don't find too many Indian women to be regular smokers, but yes, smoking itself can be a high risk for deep vein thrombosis, so definitely avoid it before conception, during pregnancy and after delivery as well.
Fantastic. I think this has been the longest podcast we've recorded, or maybe even I have recorded separately. But thank you, Apurva. I think it's been really beneficial. It's been really good. At least we feel so. And I hope that it benefits the delivered mothers in the real sense, and not by way of putting them to sleep with boredom with a long podcast that we've recorded. Thank you so much, Apurva. It's always a pleasure doing work with you, recording things with you. And I will see you in the next edition, or that is the part 2 of endometriosis, which we're going to record and upload very, very shortly.
Thank you so much for having me, Dr. Rajeev. It's always a pleasure to kind of come back and record. Again, as I said, it's incredible the amount of effort that you put into putting in so much information and important, relevant and correct information to all the clients out there.
Thank you, Apurva. And for the listeners, if you get a chance, do look up my website www.drrajeevagarwal.co.in and the associated blog. I also have a YouTube channel in my name. Do email me on fertilitywithoutborders@gmail.com if you have any queries, or if you want me to create a podcast on any topic of your choice. This podcast is available on Anchor, Headphones, Spotify, Breaker, Google Podcast, Overcast, Radio Public, as well as Apple Podcast. Do subscribe to any one of them or on Apple Podcast and leave your comments and suggestions. Looking forward to great interactions. Keep listening.